Thanks for tuning in to Healthy Planet One, where we discuss healthy living from experts in each of their fields. This is your host, Patricia Starr.
And your co-host, Kimberly Knox.
Welcome, everyone. Today's guest on Healthy Planet One is Dr. Watts. We are so pleased to have you join us today. He is the owner of the Renewal Point here in Sarasota, and we'll be talking about breakthroughs in bioidentical hormone balancing. Now, I know, Dr. Watts, you started out as an OBGYN, and then you went into Functional and Integrative Medicine for 20 years and are now board certified in 4 specialties with a master in Nutritional and Metabolic Medicine. So there's a lot to cover here. And I also know that you are one of the leading physicians in Florida and a professor at the University of South Florida at LECOM, right?
That's right. Yeah.
It's a pleasure having you on today. Thank you for coming.
Well, thank you for having me on. Yeah, it's a pleasure.
So you practice functional and integrative medicine. What would you say is the primary focus of your practice?
Yeah, so like you said, I started practicing, well, probably I was practicing functional and integrative medicine before I knew what the names were. But I started, so at the Renewal Point, we try to make it simple. We practice on 4 main points. Our primary focus is 1, nutrition, which we believe nutrition or nutritional deficits, the lack of nutrition, good nutrition is some of the most things that you can do for your health. Also, natural hormone balancing. I want to stress that word natural, hormone balancing, and also physical fitness and toxins or toxin elimination. So keeping toxins out of your body. That these are the main lifestyle things. I practice more lifestyle medicine, to give another word for it, and that is to just keep our bodies healthy by natural means. Sometimes our bodies need just to be put in good natural medicine will be some of the best things that you can do for us.
Well, you know, Dr. Watts, I've known you, I've known of you, I should say, in Sarasota, Florida here for a number of years. I know there's many people that go to you. And what I love hearing is that you talk about the natural hormone balancing. And I know that, 20 years ago when I went through breast cancer, there was a whole lot of questions about hormones and hormone therapy. And I actually studied with Dr. Stephen Love, if you remember that name, who was into the natural hormones. So I'm thrilled to talk to you about that, because people need to really work from the inside out, not just cover up the symptoms, right?
Right. Yeah, that's a lot what we do in integrative and functional medicine is work from the inside out.
So what brought you to work more with the lifestyle and natural hormone, given, your background as a medical doctor?
Well, so I went to medical school in Tennessee, Memphis, back a long time ago. So I've been practicing maybe over almost 50 years, believe it or not. And at that time in medical school, we studied how to diagnose and treat diseases, usually through drugs or surgery. Mm-hmm. And I got out. I was actually a general practitioner up in Tarpon Springs for the first maybe 8 to 10 years of my practice. But I found it to be real good. I found that drugs and surgery worked well, mostly for acute medicine. But I started looking into, well, what happens before that? How could you prevent conditions? How do we actually stop them before they actually become conditions that we have to treat? Mm-hmm. So I was thinking about that or concerned about that. I went to a meeting at the A4M. It's the anti-aging medical conference. It was in Las Vegas. My eyes were open. My jaw fell open. I could not believe that. Here were doctors and PhDs from all over the world. And they were studying how do you help the aging process. And they were using natural means to do that. I just became a passion for me after that. So we started studying. I started studying it, read everything I could. As you said, I gotten, certified in about everything you can right now. So I just find that a passion for me to study about that.
It was jaw dropping at the time, because it took you then into this whole natural world and lifestyle, correct?
Correct. Yes.
So tell us, what's the difference between natural bioidentical hormones and synthetic chemical hormones?
Okay, so hormones are messengers that are given out by glands in the body, and there are lots of these glands all throughout the body, but they send messages of health and well-being throughout our body, or sometimes ill messages if they're not balanced. So they send messages to the brain and to the heart and actually to all cells. These messengers are actually molecules, and they act by a lock and key principle. The hormone being the key and the lock being a receptor site on each of our cells. So each of our cells has a key, a little lock that it fits in, but it has to be an exact key that fits an exact lock. So natural hormones are exact copies of that key, or exact copies. So I always say God would know the difference between the molecules. They're usually made from, they start off with soybeans or yams, so they start with natural product. Whereas the synthetic or chemical or patented hormones are molecules that are made to act like these hormones. So they're not the exact key. They don't fit that exact lock. And so they cause problems. You'd start wondering about it because they're actually made, they start off being made from horse urine or kerosene. I mean, they're the most, I guess, ungodly products that you can imagine, to start off with. But these, because they're not exactly like the natural hormones, they can cause a lot of problems, such as cancer, such as Alzheimer's or inflammation of the body, heart disease, whereas the natural hormones don't cause any of those. They actually improve health. They actually improve Alzheimer's up to 50%, heart disease, decrease that up to 50%. So you can see there's a lot of difference between the two type hormones.
There is a lot. And I'm wondering, are we still using these synthetic hormones this day and age?
Absolutely. Yeah. Are
we getting away from them at all?
They are getting away from them. I noticed a big trend. Of course, that's, as I said, one of the main parts of our practice is natural hormone balancing. So I see a big trend. When we started this 20 years ago, it wasn't, it's considered almost quackery or, unusual medicine at that time. And we were poo-pooed by many of the doctors. Now, I'd say most doctors know about it, have heard about it, and are actually studying natural hormone balancing.
So what are some of the challenges with really creating a natural bioidentical hormone for a woman? Because we're all different, right? So, right. And a man too. We're all different biologically. How do you approach that?
Now, what? Give me what is that question?
How do you deal with somebody who's come in, and do you give the same bioidentical hormone to across the board, or do you work individually? Because I know there's some tweaking that has to go on sometimes with that.
Absolutely. Sounds like you've talked about this before. So
only with Dr. Love, right? So
Dr. Love. Oh yeah, that's right. So yeah, natural hormones are balanced individually. So we usually take either blood or saliva or sometimes urine. We can use a lot of different ways to check the hormones, but we'll use these methods as our guide, and plus the symptoms, the symptomatology or side effects. Side effects with the patented or chemical hormones are very common, and with natural hormones, we expect zero side effects. So that, and then they're individually, we take those lab tests, and we're able to then tell if we're balanced or not. And then also the symptoms, because the lab tests don't tell us the whole picture. Like I said, we just use it as a guide to help us.
So you may have to tweak maybe the type of prescription that you want the person to take, depending on how their body responds to it. Is that how you deal with that?
That's initially. Now, and also you have to consider that people change. So we don't stay the same. Our stressors change, our weight changes, our age changes. We go through different life cycles. And so as they change, we need to tweak the hormones a little closer.
So how do you do that? Do you recommend people come to you periodically? What's the practice that you have for that?
So if a person's interested in natural hormones, usually they come for a consultation and we get their records, we get the doctors that they're using right now, their gynecologist or their general practitioner or internist. We get records from them. We get the symptomatology, what is the person experiencing, what is their goals, what do they want to. It's usually going to be things such as weight goals or sleep or anxiety or depression or fatigue, these type problems that a person comes to us with. And then we're able to then run the test, as we were just talking about, get the test back, and we're able to help them start on their journey to help getting their hormones fixed.
So I wanted to ask a great question. I'm an integrative health coach. I was trained in hormone health therapy as well. I know a lot of people know about the classic hormones, testosterone, progesterone, estrogen. So are there other ones that you're talking about for people, or just the primary ones here?
Yeah, of course, there's thousands of hormones, and we don't work with exactly all of them, but there's brain hormones. There's 200 brain hormones. We work with probably maybe 8 of those. They're called neurotransmitters or neuropeptides. There's hormones in the thyroid gland. There's many hormones in the adrenal gland. Adrenal glands are some of the most important. The cortisol, the DHEA, these hormones are aldosterone. So these hormones control stress. There are hormones in the gonads, which we're talking about testosterone, as you were saying, estrogen, testosterone. In the pancreas, some of the most important hormones are in the pancreas, the insulin that controls our sugar, blood sugar. There's actually hormones in fat tissue. So fat contains hormones that we're now understanding are given out to tell how fat we're supposed to be. So hormones such as leptin and ghrelin, things such as that, which control how fat we're supposed to be.
Yeah. So it sounds like people get a broad understanding and education as well when they come to you to talk about hormones.
Yes, that's right. We have a value toward education. And by the way, I noticed that I think your Sarasota Holistic Chamber of Commerce and also the Healthy Living, Healthy Planet Radio, the one that we're broadcasting over, I see that they have a very big value, that one of their missions is to educate people on healthy living, and totally agree with that.
Absolutely.
Yeah, it's a big thing, because they're like you're talking about, you started where you started, and now we learn more and more and more, and it's really up to the individual. And I'm sure you find this with your clients, that they need to be educated as well. Those are your best clients, aren't they, Doctor?
We find that usually our clients are going to be more, I'd say, educated. They have a very high value toward their health. So programs such as this, reading the different, doctors that are promoting natural health and natural medicine and their environmental health are the ones that come to us. So we find that our patients are usually more highly educated than I'd say most. That's why they're coming in as a rule.
Right. And it's interesting because, when you talk about hormone, and of course we look at the aging, the change of life factor, the menopause, which I know is known in men as angiopause, because men go through the same change in different ways that women. You want to talk a little bit about that?
Yeah, that's an interesting subject. So men they go through very similar changes, most of them as we get older. So you have several years, let's say up to about 20, 30 years, that you have very strong high hormones. We all remember that in our 20s and 30s maybe. For men, they start going over the hill, I would say, at about 20 years old, so way earlier than females. And we go very, very slowly, somewhere in the range of 1% a year we have falling of our hormones. So we go so slow that we don't even know what hit us, by the time that we're down the road, say in our 50s or 60s. And we call this the gray zone as a rule for men, because we just feel down. We don't know what's happening. With females, it's much more cataclysmic. You will usually go through during your reproductive years, be very well protected for your hormones up in your 20s, 30s, even early 40s. But about that time, most women will start feeling what you would call wobbling of the hormones and up and down or imbalance in the hormones. And they're very disconcerting, cause sleep problems and anxiety and hot flashes and things such as that. And then all of a sudden a cataclysmic crash about in the 50s, early 50s.